please stop doing these low back exercises and stretches right now. Hi, my name is Dr. Scott McCrimmon, and I'm a chiropractor with Cal and Nice Family Chiropractic. Our channel is devoted towards giving you and your family the latest and most up-to-date health information to keep you active, pain-free, and living a healthy lifestyle. If you like the information you hear in this video or any of our other videos, please give us a like, click the subscribe button, and even turn on that notification bell so you can get the latest videos as they come out each week. In this particular video, I'm going to show you the biggest mistakes that I see patients make when it comes to exercises for their lower back. We've all been told the importance of stretching and exercising to keep our back healthy, and that is very, very true. However, so often I see people doing the wrong exercises, which might actually be causing their back pain, contributing to it getting worse, or even preventing it from getting better. Okay, before we get going on me showing the exercises that I don't want you to do, I want to explain a little bit of anatomy so that you understand why we're telling you this information. Because I always find when you understand the reasons behind what we're telling you, you're more likely to follow along and be as healthy as you possibly can be. When we look at the spine from the side, we should have three curves. This curve is our neck, this curve is our mid-back, and this curve is our lower back. We're going to focus down here for today. So when you look at me from the side, step back here, you should see my back should have this little bit of an indent or curve coming in. We call that a lumbar lordosis. That's very important because in our spine, we have these things here in between the bones or in between the vertebrae called discs. And they are very important for the function and health of our spine, give our body mobility. However, they can be worn down, they can be injured, and that is where we see a lot of problems in our lower back. When I'm explaining the function of a disc to patients, I always like to use food analogies. They really seem to make sense and people understand them. So let's look at our low back disc here, our lumbar spine disc. We have a vertebrae on the top, a vertebrae on the bottom, the disc in the middle. One of the analogies I like to use is an ice cream sandwich. We all know what happens if you squish down an ice cream sandwich, right? It starts to flatten out. Now, if you squish more on one side than the other, then that ice cream is going to start to bulge out or push out or even herniate out the side opposite to where we're putting the pressure on it. That's really important when it comes to doing our exercises, because if we add too much pressure through the front of the vertebrae and then that disc starts to squish out the back, at the back we have our spinal cord and our spinal nerves. These nerve roots in the lower part of the lower back, they're what make up our sciatic nerve. For those who've experienced sciatic pain, you know it's not a lot of fun and not something we want to go through. Okay, it's a weak area for our back that we don't want to put a lot of pressure through. The other way I like to explain this are like a jelly donut. So if we take a cross section, so looking straight down our spinal cord here, you can see a disc has a harder outside and it has this jelly in the middle, which is nice, usually a nice little circle in through the middle, in the middle of the disc. Okay, but over time, as we keep adding pressure, like I showed with the ice cream sandwich, that disc or nuclear material, or the jelly can start to work its way to the outside. It can start to break down as the outer parts of the disc go down. It starts to break its way through. If it gets all the way through the edge of the disc, it can push right out, and that is what we call a herniated disc. Okay, an experience that I don't want anyone to go through. We see it often in our office, and it's really quite uncomfortable, quite painful, and can take quite a long time to heal for many people. Now, our discs, like most structures that we have in our body and even out in the world, they break down with the more and more stress that we put on it. So a lot of the exercises that I see people doing are putting more stress on the disc, causing them to break down prematurely, and then leading to injury. That can be significant, like a herniated disc, even a bulging disc, even just increased inflammation or putting our spine in a weak position. Okay, so let's look at some of the exercises that I really don't like, that really put a lot of stress on the lower back. The first one, many patients tell me they love to do this when they first get up in the morning, is they stand there, they bend over, and they try and touch their toes as best as they can. Sometimes they'll hang there, sometimes they'll swing. That puts our lower back in a lot of flexion and can put a lot of stress on those discs that we just talked about. So like I mentioned earlier, our spine should have these three curves: neck, mid-back, and lower back. Well, when we bend forward, you can see what's happening to these discs. We're starting to put all the pressure here at the front of the disc, okay? And we know from our ice cream sandwich analogy, if we put pressure at the front of the disc, it's going to want to push that disc backwards. And again, over time, we keep putting that stress on the disc more and more, it's going to start to wear down, okay? There's a chance that nuclear material, the jelly in the donut, starts pushing its way towards the back as well. And again, we know our sensitive structures are back there. So anything involving a lot of flexion through our lower back definitely can make it worse. So that standing, trying to touch your toes exercise is an absolute no-no for me. And along the same lines, another one that I see often is people will sit on the floor or on their bed with their feet out, and they'll just reach as hard as they can and try and touch their toes. Well, look at the flexion or the bending that that's putting in my lower back. That, just like the standing, trying to touch your toes, really puts pressure down through those discs, and I'll keep saying it again, over time, those discs keep wearing down. The more stress that we put on them, the more likely they're to wear down, and they'll have, like everything, so much durability in them before they start to break down. I actually had a patient once who was high up in a large company. They did fitness testing for their VPs, of which he was one. And one of the exercises that they did in their fitness testing was ask him to try and touch his toes, sitting in this position. And of course, they're encouraging him push, push, push. He blew his back out, and he was a year, 12 or maybe 14 months of significant disability and pain in his back, just from set off by doing that particular exercise there. So again, with our legs flat, straight, do not like that exercise at all. Now, I'll always have people say, but doc, I gotta stretch my hamstrings. My hamstrings are tight, and you always tell me that tight hamstrings can contribute to low back pain. That's very true. But you never wanna stretch your hamstrings with your feet or your legs locked and all the motion coming through your back. So the way I show patients to stretch their hamstrings, really simple. Lay on your back, grab behind your knee, and then just pull your leg up. As straight as you can comfortably make your leg, pull up like this, you'll get a nice stretch through your hamstrings with zero stress on your back. Much easier, much safer, and any exercise I can do laying down is always good too. The next exercise that I want to show that I don't love when patients do is our double knee to chest. Another really common exercise that people do. So that involves laying on our back, grabbing both our knees, and pulling up to our chest. Again, you can see as I'm doing that, I'm starting to round that lower back or putting flexion in through the spine, in through the disc there, which we know they don't like. A really simple alternative, keep one leg down, pull one leg up at a time. Much less stress through your back. You're not putting that flexion through your spine and your disc. You can still get the stretch on either side, and you'll be a lot happier for it. So those are a couple of the common stretches that I see from patients that I really don't like, that I find can actually aggravate or make the lower back worse, with a couple modifications. Now I want to show you a few strengthening exercises. With our spine, especially our lower back, a lot of people think about gaining flexibility and gaining mobility because they feel stiff. And what the research shows is that your low back is actually supposed to be a little bit stiff. So when we talk about stretching for our low back and increasing mobility, our low back is really part of our core. And when we talk about our core, we always talk about strength and stability, not flexibility, okay? The mobility should come through our hips, okay? If we have to bend, and I'll show you a little bit of that in a second, the mobility shouldn't come through our lower back. Our lower back is meant to be strong and stable, and to really be part of our core and support our body. So our core is, our abs, that's what people think of as our core, but also our glutes and our lower back, they are what make up our core. So we want strength and stability as opposed to flexibility, which is why I don't encourage a ton of stretching specifically in through the lower back, especially inducing that flexion. When we look at core stability, there's a lot of exercise that comes to mind: crunches, sit-ups, planks, bird dogs, a lot of these things that many people have done. And there's other videos on here that are great for showing you core stability exercises. But there are some that people do that also really put stress through our lower back, create that flexion, and put stress through our discs. So I'm gonna go through a couple of those right now with you. The first one I'm gonna show you is the classic sit-up. So again, we go back to our laying position. And what is a sit-up? We sit here, we come up, and look at my lower back. Again, we've got that nice rounded posture that we're trying to avoid, as well as a little bit of extra stress from the contraction of our muscles, okay? The other one that people do as well is the crunch, or they come up just part way, but again, you can see I'm putting that roundedness through our back. I see a lot of injuries from sit-ups and crunches. I do understand it does work the core, and for some people it may work out well, but for a lot of people that does put extra stress through our back. One way you can modify that to make it a little easier, more comfortable, if you're someone who really finds that a beneficial exercise for you, is simply put a rolled towel under your lower back, or I like to use my hands. And what we're trying to do here is I'll lay back, I'll put my hands right into the small of my lower back to create that curve or that lordosis in our spine. And then when I do my crunch, I only come up just so my shoulders come off the ground. You don't need to go any higher than that. There are plenty of other exercises that are great for your core. So if you feel you have to do it, this is about as much as I would do. We don't need this. Again, put too much flexion in our back, too much stress through our lower spine and those discs. The last one I want to show you for today is that I don't really like for lower back is our double leg lift. I know a lot of Pilates people may not be happy because it's an exercise commonly done there. And like any exercise, there are benefits, but right now we're looking at the risks. So if you have a bad lower back or weakness there, I've had trouble there before, not an exercise that I find great because it puts a lot of stress on our lower back. So the exercise is laying on our back, legs straight out, and taking your legs and lifting them both up in the air and holding them like that. Okay? Yes, it does work the core, but again, we're inducing flexion, putting pressure through our lower back. We actually use this as a test in the office if we're looking at potential disc injuries in patients. We'll ask them to try and do that. And if their discs are irritated or aggravated, a lot of times they have a really hard time. So whenever you're doing exercises for your lower back, whether it be stretching, whether it be core strength and stability, always remember to try and maintain this neutral or lumbar lordosis. That will protect your disc, put pressure back on the joints where it's supposed to be, keep the stress off the front of the disc, off our ice cream sandwich and our jelly donuts, and will help them last longer. They only have so many repetitions or can only handle so much wear and tear before they start to break down. So the more stress you put on them, the more likely or the higher the potential of having back trouble as you go down the road. Our goal, as always, is to keep you as healthy and as active as possible. So I hope you found this information helpful. If you did, give us a like, subscribe to our channel, and you'll get the latest information on a variety of topics from all the healthcare practitioners here at Caledonian Family Chiropractic. Until next time, hope you have a great day.